or Kasarogi, or the persons with respiratory allergy, or persons with respiratory infections in Ayurveda. That is the today's focus theme, the theme of today's focus. And now let us come to the topic. Yeah. So my today's paper consists of just an introduction regarding the respiratory disorders as well as their samprapti and classification. Definitely, it is not a theoretical perspective. How a practitioner and how the classification should be based on how the classification to be done based on practical aspects. A practitioner, how to approach the Shwasa Yogas by a practitioner. That's what the main area of my focus, and some of the critical analysis of some of the common yogas in respiratory tract allergy as well as this infection, then some of the rasa yogas if needed, and then conclusion. So the introduction, as the introduction part, usually the best thing is the first thing what we have to, not only in the case of respiratory disorders, in the management of all the disease, all the systemic diseases, that we have to be very careful regarding three aspects. The first one is the precise diagnosis as well as precise selection of the medicines. The second one is the typical understanding or critical understanding of the red flags or warning signs. That means we should be very thorough regarding when we have to regarding the point when we have to refer the patient, when we have to admit the patient, when we have to do the shamana therapies for the patient, when we have to do the shodhana therapies of the patient. Especially, we should be very much thorough regarding the red flags exhibited by the red flag symptoms exhibited by the patient. And finally, we should reduce our prescription, the number of medicines as much as possible. So how to reduce the number of medicines? Definitely, we can simply cut off the medicines from 5 or 6 to 2 or 3. But that is not the matter. So we have to be for reducing the number of the medicines, what we have to do is, first we should be thorough regarding the diagnosis. If we could diagnose the disease properly, then there is no need of selection of much medicines. That means beating around, we can avoid the term that is beating around the bush. With 1 or 2 medicines, we can get the exact result, what we expect. Or at the same time, we may get the little more, the more result that we expect from the higher or with the more number of medicines. See, if we are mixing of so many medicines, there can be a drug-to-drug interaction. So we may not get the proper result what we expect. So always better to reduce the number of medicines as much as possible. Then only we can forecast the result. So for how we have to reduce the medicines, for that purpose, we should know thoroughly regarding the properties of each and every medicine. We should know where we have to give this medicine and where we have to give the other medicine, or we have to give where we should avoid such kind of medicines. So such matters we should be very thorough. For that purpose, we should analyze the nature of each and every yogas precisely or critically. So how to carry out that we will see now. We know these are the Swasaroga Nidanas. Everyone knows that. All of us have studied in the second year Nidana paper as well as the the Kai Chikitsa paper. But I'm not going to the details of the theoretical part. Just whatever the things which we need to understand the further practical aspects, we need little bit theory part. So I'm explaining only that part. I'm just picking from that such topics from the Samhitas and making into the practically applicable form. So I'm not a theoretician actually. I'm not a teacher, and I'm a typical practitioner as well as a pharmacy person. I'm working as a consultant or as a senior physician in the quality control department as well as this research and development department. So always my focus is to not the theoretical part but the practical as well as the manufacturing part. So, what are the permutations and combinations what we can make with our different kind of medicine, that we will see. So we know that the nidana part. Dhumopagata, rajasastadheva, vyayama rukshana nishevanacha, vimargagattvadapi bhojanasya, vegavarodhat kshavadhosyadasya. These are the nidanas what we have learned. Dhumopagata, rajasastadheva, vyayama rukshana nishevanacha, vimargagattvadapi bhojanasya. So we will keep that part apart. Now comes the most important part of our treatment, the samprapti. That is pranagni udananugata pradishta sambhinna kamsya sunatulya kosha. Pranahi udananugata pradishta sambhinna kamsya sunatulya kosha. So the affected or the vitiated doshas are, it is vata only, and precisely it is prana and udana. And when we come to the samprapti, Acharya clearly explained, atha pradhihato vayu. Atha pradhihato vayu means what will be the condition. Atha pradhihato vayu urdhvastroda samasrida udana rupamapanna. So what is the medicine? What is the dosha vitiated here? Which is atha pradhihato adho vayu. Atha pradhihato vayu urdhvastroda samasrida. The vayu which has been situated in the lower part of the body, which has blocked, and udana rupamapanna, which has attained the properties of udana. What is udana? Ud nayati. That is, ud nayati means nothing but which has got the property of moving upwards. What is apana? Up nayati. That is which goes move downwards. So here the apana vata is getting blocked with some other factors, which are the factors that we will see. So with that the apana vata is getting blocked with some factors, and the natural flow or the natural movement of apana vata is being reversed, and udana rupamapanna. This apana vata gets the properties as well as the rupa, the symptoms, the lakshanas like udana vata, and then does the disease manifestation. So here this is the important one. The avarana of vata. The first one is nidana sevana, that is dhumopakatha, rajasastadheva, vyayama rukshana nishevanacha. Such, because of that nidana, you see that nidanas, even though we know that the symptoms what we get during kasa or swasa is nothing but it's more or less similar to kabhaja roga, isn't it? A severe expectoration, otherwise severe chest discomfort, heaviness to the chest, etc. But still, see the nidanas. Everything, all the nidanas are vada prakopa nidanas only. Dhumopagata, raja, vyayama, ruksha anna nishevana. Then again, vimargagattvadapi bhojanasya. Everything are vada kopa nidanas. So here, due to the vitiation of apana vata, and then because of the avarana of kapha or pitta, the apana vata is getting blocked with the other factors and getting the swarupa of udana vata. Then and locates kantha and uras, urdhva srodha samasrada. Then fills in the srodhas and produces kasa. This is the simple samprapti of kasa. And we can select the medicine only when we are thorough with this samprapti. How this samprapti can be made applicable to the practical aspects. Don't think that these are directly just simple theories only, but always this type of theory, the practice of Ayurveda is the foundation of Ayurveda is typically based on this type of theory only. So we will see how we can apply this theory to the practice field. And once the kasa is developed, definitely next kasa vruddhya bhave swasam purvair vadosha pomare amadisara vamathu. Like that it's continuous. So now we will see. So we will see the classification of kasa, isn't it? We know that pancha kasa, isn't it? So vata, pitta, kapha, kshayaja and kshadaja. But For treatment purpose, this much classification is not sufficient. We need to go in little more detail regarding the classification part. Then only we can select the medicines precisely. So simple Vadika Kasa, diagnosing simple Vadika Kasa is not sufficient. Simple Paithika Kasa is not sufficient to reduce the number of medicines. But how to reduce that? How to precisely, how to disintegrate the classifications little more precisely, that we will see. See, when we go to the practice field, when we go to the medicine field, we have to differentiate the treatment for definitely there are 5 types of Kasa only: Vata, Pitta, Kapha, Kshata, and Kshaya. But simply diagnosing Vadika Kasa is not sufficient to get the proper the result, because the line of treatment explained by Acharyas in Vadika Kasa, which is occurring to the Vata Prakriti person, and the Vadika Kasa occurring to the Pitta Kapha Prakriti person are entirely different. At the same time, the Paithika Kasa, simple Paithika Kasa is not sufficient, because there are 2 types of the Paithika Kasa is being again subdivided into 2. That is Paithika Kasa with Tanu Kapha and Paithika Kasa with Ghana Kapha. Here also the treatment is entirely different. Again, the next one is Kaphaja Kasa. When we go to Kaphaja Kasa, again there are 2 types. Kaphaja Kasa occurring to the Balavan, or Kaphaja Kasa occurring to the Durbara person. The treatment line is entirely different. How we can select the yogas according to these precise classification, that we will see now. We will discuss as presenting complaint, as case by case we will discuss. So, shall we go to the first case? A male patient came to us with severe dry cough, with resonance, severe resonance since 1 week, associated with throat dryness, headache, and lethargy. These problems seem to be increased immediately after food and early morning around 3 to 4 a.m. His complaints were little bit reduced while sipping hot water, lime juice with sainthava, or lime juice with salt and warm water. Again, at the same time, when we go to little more deeper, when we ask little more leading questions to the patient, he reveals the history of habitual constipation, irregular appetite, and disturbed sleep. Again, he has got severe inability to withstand cold climate, cold wind, etc. Whenever he exposed to cold climate or cold wind, the problems get worse. So what could be the diagnosis? Yeah, you can, I think we will make it an interactive session. You can post the answers in the chat box. Can anyone? What type of Kasa is this? Is it Vatika Kasa or Paithika Kasa or Kaphaja Kasa? Yeah, Vatika Kasa, Vatika. Okay. Definitely. Oh, someone has Paithika Kasa. Okay, let it be, no problem. Vataja Kasa, Vatika, Pittaja. So now we will see. It is typical Vatika Kasa only. Yeah, Pittaja. So many answers, confuse you. Actually, I am also got confused now. So there are, so the majority is for Vatika Kasa. Definitely, we will fix on Vatika Kasa itself. So, what type of Vatika Kasa? That is the main thing. As I explained, the treatment explained by Acharyas for Vatika Kasa, for Vatika Kasa occurring to the, what we say, the previous one. There are 2 types of Vatika Kasa, isn't it? I explained. 1 second. So, I will go to the previous slide. I am not able to change the slide. see, this slide should be thorough with everyone's mind. Then only the further case we can explain. So Vadika Kasa for Vata Prakriti person, Vadika Kasa for Pitta Kapha Prakriti person. So please do concentrate on this slide. So now, by keeping that purview in the mind, now you think of this case. The leading factors are nothing but the symptoms are severe dry cough with resonance. Kupitam Vadalayar Vadam Shushkora Kanthavakradam. Again, Krit Parshola Siras Shola Mohak Shova Surakshayan. Now, these are the pointers to the diagnosis. That is nothing but Vadika Kasa. And the other things are the confirmatory sign. Immediately after food, the problems seems to be increased immediately after food and early morning, around 3 to 4 a.m. Why that time? That is the main thing. That is the Vada predominant Kala, isn't it? Grishma ahoratri bhuktande pragupyandi samirana snigdhamla levanoshnescha samam. So just we have to ask the patient to some of the leading questions. So which is the Vadika Kala? That is very difficult to diagnose. But at the same time, if we ask to the patient, so do you get any disturbance regarding the during your sleep? Are you getting disturbed due to cough during sleep? Definitely, he will explain. He will say, the patient will say that yes, I am getting the different the difficulties during. At the time, most of the time, he says that when I get awakened for passing urine at the time of maybe around 2 o'clock or 3 o'clock, severe irritation is there, and see the cough is getting increased. So we will ask again. Then how do you subside that? Whether it gets subside simply? No. He will say that no problem. Just when I drink some little bit warm water or water with salt, definitely the problems get subsided. These are the pointers to the associated symptoms, the associated vitiation of dosha. Again, snigdhamla levanoshnescha bhukta pidei prasamyati grishma aho ratri bhuktande pragupyandi samirana. So, and now the diagnosis is Vadika Kasa. Now the another thing is, we have to diagnose whether he is a Vada Prakriti person or Pitta Kapha Prakriti person, because the treatment is differ in Vada Prakriti as well as Pitta Prakriti person. So, from the symptoms like habitual constipation, irregular appetite, and disturbed sleep, and Shita Sahishnudha, the inability to withstand cold and cold climates, points to the Vada Prakriti nature of the patient. So here we can diagnose the disease as Vadika Kasa occurring to the Vada Prakriti person. Now we will go to the treatment. Again, Vadika Kasa occurring to the Vada Prakriti person. So the Samprapti goes like this. Because of Vada Kopanidhanas. What are the Vada Kopanidhanas? Tiktoshana Kashayalpa, Yuksha Pramita Bhojanai, Dharana, Udirana, Nisha, Jagara, Atucha Bhashanai, Kriyadi Yogam, Bhi, Shogam, Chinda, Vyayama Garshani, Grishma Horatri Bhuktande, Prabhupyandi Samir. Because of these type of Nidhanas, there is the increase of Vata in Koshta without the Avarana. This is why I told that the first Samprapti is very important. There are two types of Sampraptis. One, the Samprapti with Avarana, and the another one is Samprapti without Avarana. So here, in case of typical Vadika Kasa, absolutely there is no Avarana. And thereby, the treatment also differs from the other set. Here, without Avarana, because of the highly increased the Apana Vada or Udana Vada, so that gets moves upwards and locates over here without any obstruction, and that causes excessive dryness towards the chest as well as the larynx or whatever it may be, the entire respiratory tract, produces kasam, and from this kasam it goes to swasam. Now, again, when we come to the treatment line, the treatment is Rukshasya Anilajam Kasam Adau Snehe Rupachari. Many a times we do mistakes. Even I also committed mistakes in the previously. severe cough itself and the dry cough, even though if it is severe dry cough itself, most of the time we give Elaganadi Kashaya or the Simulakatrayan Kashaya or Vyagrayadi Kashaya, like that. Definitely, such a prescription, we have a habit of giving this, what we say by default, the Simulakatrayan or Indugandha, whatever may be the cough, whatever may be the kasa, or whatever may be the swasam. Our first line of thought goes to this type of medicine, that is the Simulakatrayan or Vyagrayadi or Indugandham or Balajiragadi, etc. But in this case, such an approach is entirely wrong because this is purely Vadika, and there we should start with the Rukshasya Anilajam Kasam. Vadika Kasa occurring to a Ruksha person, that is nothing, Ruksha person is nothing but a Vada Prati person. So, Anilaja Kasa occurring to a Ruksha person should be treated with Adu Snehe Rubhadire. We should start the treatment with the Sneha Prayoga. There is one apana or when the tree in the context of Vata Vyadhi, there is one line called Tam Snigdhair Anulomayet. We have to do this anulomana, especially in this type of Vadika conditions. We have to do this anulomana with the Snigdha Dravya. How to do the anulomana with the Snigdha Dravya? So mainly, we will discuss the properties of this and all these medicines in later. Now I will just demonstrate the set of medicines. So initially, in this case, if the Agni is proper and there is no other Ama Lakshanas, etc., we can directly go for the Snigdha Prayoga. What could be the Ama Lakshana, the Agni is proper? That how to understand whether if the patient is suitable for Snigdha Prayoga or Grida Prayoga or not. That we have to fetch from the Jurajigulsa. That is Kashaya Panapatyana Dashahayridilinkita. Again, Vada Vittotere Jure. Kaphe Mande Vada Vittotere Jure. So if the patient is, when the kapha is reduced and the condition is Vada Vitta Pradhana, you have to go for this type of Snigdha Prayoga. That is, probably you can use 3 types of medicinal gradas. Usually I use in my practice. That is, one is Indugatam, the second one is Vidaryadi, and third one is Rasna Dashamulati. And Arishtam, Abhayarishtam as well as Jirarishtam. But there is one difficulty in using Arishta. We don't use, most probably this Abhayarishtam, etc., are the most underestimated medicine. Abhayarishtam is the wonderful medicine in Kasa. But the only thing is, the person is Ruksha, the person is Vada Pradhana, the disease is also Vada Pradhana. Arishta is also Ruksha. Arishta is also Vada Kovaga. So here, even though it is Anulomana, so we have to do the Snigdha Anulomana here. You can mix, the best method is you can mix this Arishta with the Grida. That need not be the medicated Gridas like Indugandham or Vidaria. The simple cow's ghee is sufficient. Usually I do in my practice like that. 20 ml of Abhayarishta with 2.5 gram or 2.5 ml of simple cow's ghee twice daily after food. Alone is sufficient for the Vadika Kasa occurring to the Vada Prati person. You can just try. Absolutely, there is no need of any other medicine. This is for sure. You can just try this Abhayarishta with any of the Grida after, probably after food, and that alone will be sufficient. The same effect we can get through Jiragarishta also. Now let's go to the second. A male age 15 years. Again, simple dry cough with the resonance. Since 1 week, associated with the postnasal drip. The problems seems to be increased immediately after food. The symptoms are more or less similar after food and early morning around 3 to 4 a.m. The boy explains that definitely, yeah, I get increase of cough. Or most of the time he explained as usually, yeah, I get awakened or get up at the time of 3 or at the time of 2 o'clock because of the increased cough. And the same thing, what do you do for reducing the symptoms? Definitely he said that I will just drink some of the warm water mixed with or salt or just simple lime juice, and gradually the problems reduces. Here, the difference lies is his bowel history is normal, but had a history of recurrent loose stools. His appetite was reduced since childhood. What could be the diagnosis? Symptoms, the chief complaints are similar to the previous one, but the associated complaints, previously he was suffering from habitual constipation, irregular bowel movements or irregular abdominal distension, etc. But in this condition, the bowel history is normal. At the same time, he was suffering loose stools properly. So his appetite and with reduced appetite. What could be the, again, inability to withstand cold climate, cold wind, etc. What could be the diagnosis? Again, Vadiga Kasa only. Yeah. Vadiga Kasa. No. Well, not Vada Paitika Kasa. Yes, no, it's not Pitta Kapha Prakriti. Yeah, exactly. Vadiga Kasa occurring to the Pitta Kapha Prakriti. Definitely. That is the typical diagnosis here. And the treatment here also is important. Previously, the simple dry cough, what I said is that that line is entirely wrong in this condition. Here, how to treat? Sorry. Vadiga Kasa occurring to the Kapha Prakriti person or Pitta Prakriti person, whatever it may be. Here, previously it was Anulomanam, then Pajanam and Brahmanam. And here also Anulomanam at the same time Shamanam and Brahmanam. How to select the medicine? So we can select the medicine. Here we can adopt some of the Kashaya Yogas. Definitely, if it is a Vadiga Kasa occurring to the Vada Prakriti person, never goes to any of the Kashaya Prayogas. So here we can select the Kashayas such as Nayopayam, Balajiragadi or Induganta. There are some Churnas. There are Churna options here. Talisapatradi Churna or Talisapatradi Lehya. These two are the preferable medicines preferable medicines which I follow in my practice. How to differentiate these, that we will see later. Now, we will see the third case. Again, male 30 years. Presented with yellowish thread-like sputum since 1 month. He was feeling bitter taste in mouth, dysphagia, dysphonia. Excuse me. Hello? Yes. Your class, never meeting. Sorry. So, yellowish thread-like sputum since 1 month. He was feeling bitter taste in mouth, dysphagia, and dysphonia. Previously, the problems increased at the time of 3 or 4, and now definitely he explained this. He gets awakened mostly at the time of midnight, probably 12 o'clock. In between 12 to 2, the problems increases and he used to get up. His cough seemed to be increased between or immediately after food intake. What could be the diagnosis? His bowel history is normal. He was suffering from chronic heartburn, belching, and sore throat. Sleep pattern was disturbed due to the heartburn. In between the sleep also, he gets severe heartburn and belching, and he gets to wake up. On auscultation, everything was normal, and absolutely the entire heart sounds, everything were normal, no other symptoms, systemic problems. What could be the diagnosis? Exactly, Pitta Kasa with the Tanu Kapha. Very good. So you are picking up. Very good. Thank you. So Pitta Kasa with the Tanu Kapha. Exactly. Pitta Pidakshi Kapada. Tikta Sitvam. If you ask to the patients, definitely word by word they will explain. Pitta Pidakshi Kapada. Tikta Sitvam. Joro Pramam. Pitta Srik Vamanam Trishna. Vaisuryam. Dhumago Amlagam. Burning sensation. Amlagam, this our belching, and when the problems increase, Sharan, Madhyana, Ratriartha, Vidahas Shamayeshu cha, the problems gets increased. The other problems will be there will not be any associated complaints like constipation or abdominal discomfort, abdominal distension, etc. At the same time, you feel tikta seda, bitter taste in mouth, as well as this burning abdomen, etc. Now, the treatment. Here the diagnosis is Vaitika Kasam with Tanu Kapham. And as per modern science, we can diagnose it as cough due to GERD, gastroesophageal reflux disease, which is termed as, there is a typical correlation with the Pythia Casa with Tanu Kapha with the modern medicine. What could be that? That is called as LPRD, that is laryngopharyngeal reflux disease. The problem occurring due to the excessive hyperacidity and the upward moved bile or acid gastric content, it gets irritates the larynx as well as pharynx as well, especially the trachea, etc., and produces the CASA. That is known as laryngopharyngeal reflux disease, or what is the cough due to GERD. And what should be the line of treatment? Again, there are I will tell you the line later. Shamanam, Anulomanam, and Viryajanam. Pythia Casa with Tanu Kapha and Pythia Casa with Ghana Kapha. The treatment line is entirely different. That is Snigdha Sheetam Tanu Kaphe, Yuksha Sheetam Ghana Kaphe, Karma Karya Param Bhojya, Snehe Lehe Chasasyade. In case of Pythia Casa with the Tanu Kapha, we should treat the patient with the medicines with the properties like Snigdha and Sheeta. And in the case of Pythia Casa with the Ghana Kapha, the medicine should be Ruksha Sheeta. The line is similar, Shamanam, Anulomanam, and Viryajanam only in both the conditions, but the properties of the medicine are different. Here, in the case of Pythia Casa with Tanu Kapha, again we can use this Nayopayam, Guluchyadi, Drakshadi, or Pushkarerandadi. There is another very effective yoga called Pushkarerandadi. It is explained in the Gulmadi Vilsa of Ashtangardaya. And probably there is a tablet called Acidact by Kotakilari Vilsala. That is made up of this yoga. Pushkarerandadi is a very effective yoga in this type of condition. That is, the only 4 medicines are there. Pushkarerandayor Moolam, Yavam Dhanvayavashayam. Jalena Pudhitam Pidam, Poshtadaharujapa. You can see the indication, Poshtadaharujapa. See the ingredients. Pushkara Mula, Pushkara Eranda Mula, Yava, and Dhanvayasha. That is nothing but Duspasha. Regarding Churnas, Avipatti, Sitobaladi, etc., we can use this condition. And regarding this Leha, Villuadi, we can use Nayopayam and Draksha. We will compare this yogas later. Now the 4th case. Male, 40 years, presented with complaints of severe cough with yellowish thick sputum since 1 month, associated with nausea, vomiting, and muscle cramps and fatigue. This problem seems to be increased at early morning around 4 to 5 a.m. His cough seemed to be increased between or immediately after food intake. Had a history of chronic smoking. On examination, on auscultation, mainly diffuse wheezes. We can see the severe wheezing with high-pitched continuous heart sounds. So what could be the diagnosis? Male, 40 years. The diagnostic part is severe cough with yellowish thick sputum since 1 month, associated with nausea and vomiting, muscle cramps and fatigue. Pythia Casa with Ghana Kapha. We can correlate this as acute bronchitis or the chronic bronchitis. See the symptoms. The only difference is nothing but the nature of sputum is, one is thread-like and light, and in this case it is yellowish. And the increasing time, the precipitating time and the precipitating factors are more or less kapha predominant. That's why he explained the condition that he is getting increased at the time of early morning, at the time of kapha kala. The previous one, it was Pythika Kala, and this one, it is Kabaja Kala, the problems get increased. You can just ask the patient, he will definitely answer that definitely at the time of awakening, at the time of 4 to 5 a.m. or 6 a.m. I'm getting, they may not say that at the time exactly, but still they will explain that when I am getting up from the bed, the problems get increased. Within half an hour, the problem gets resolved. And when the the sunlight comes, automatically the problems will be all right, and he will not feel any of the discomfort later. So here we can use the medicines as either Guluchadi Kashaya or Punarnavadi or Elakanadi comes here. The churnas like Chariya Karpuradi or Valiya Karpuradi, there are two types of churnas. Avaleham, you can use Murdvigadi Leha. Murdvigadi, that I will explain later. Now, let us come to the fifth case. A male presented with 40 years with complaints of severe cough with thick white sputum since 1 month, associated with nausea, vomiting, muscle cramps, and fatigue. He will also tell that the same problem. When I am getting up, the problem gets increased. Within half an hour or within 1 hour, when I start my work, automatically the problem resolves. This is what he will be explaining that. And at the same time, he said that I am getting more discomfort here, and forcefully, when I do the forceful expiration, the problems gets cured. He can spit out a little bit thick sputum, and once that sputum has been passed out, again the problems will be cleared. What could be the diagnosis? Again here also, on auscultation, you can get diffuse wheeze with the high pitched continuous sounds. What could be the diagnosis? Come on. Yeah, it is Kabajakasa only. But there are two types of Kabajakasa. Kabajakasa occurring to Durbala. Yes, exactly. Kabajakasa with that we will see. So now let's go. Is Kabajakasa probably with Durbala condition. So here the treatment is, you see the conditions, the symptoms: Kabhad, Uro, Alparu, Moha, Stimidam Guru, Roma Harsho, Ghana, Snigdha, Shweda, Sleshma Pravartana. The nature of sputum he explained very clearly. And this is exactly similar, the same as the patient exhibits. Snigdha, Ghana, Shweda, Sleshma Pravartana. Purvane, Purvaratrecha. Again, the increasing time is Purvane, the early morning time, as well as Purvaratrecha. So the problem gets increased. And here the treatment is Vamana. Again, Pathya Bhojana. Here we have to use all the Ruksha Kriya with the dietary restrictions such as Yava. Because this is the actual Samprapti what we explained in the beginning. That is Udana Rupamavana Atha Pradikato Vayu Limbanurta Samagata Udana Rupamavana. So that blockade, that obstruction of Kapha of Avanavata, and which is getting transformed as Udanavata. And the Pathya Bhojana with the Acharya explained as Yavanam Vigritikshayam Kalashayam Chashile. So the Takra, Yava Vigriti, etc. being explained here. What could be the significance of Yava? That we will see later. When we see the next yogas, we will see. Here, we can use the main ingredient, the yogas like Vyagriyadi Kashaya. There is one Kashaya which is called as Daru Nagaradi Kashaya, which is not available in market, but still it is explained in Sahasra Yoga Jwara Chikitsa. The indication is Mrityukalpam Jwaram Jayet. So, it's more Ruksha, Tishna, and Ushna. Again, the Shamulam Kashaya, along with the Yava Churna, as an Anubana you can use. Aragwadhadi or Valsagadi Ganam. Again, these are all explained in Kabaja Jwara. Aragwadhadi Sakshaudram, Valsagadir Jayet Jwaram. He explained, Acharya explained in Kabaja Jwara Chikitsa. That is Aragwadhadi Gana or Valsagadi Gana with the honey, with Mathu. Or the Shamulam Kashayam with the Yava Churna as a Praksheva Dravya is very effective in this type of condition. Then Vyagriyadi Kashaya. When we come to the Churnas, either Panchakola Churna or Shadharana Churna, we can use this. When we come to Agastya Rasayana, Avaleha, it is Agastya Rasayana is suitable only in this condition. That you should be very careful. Not all the conditions that Agastya Rasayana is suitable. Not all the conditions the Samula Hridegi is suitable. Not all the conditions this Vyagriya Hridegi is suitable. Again, if you want to do the proper, again, if you want to go for the Vamanas, etc., you can use this Kantakari Krita as a Snehana Dravya for Snehapana. Now, Kabhajam and Shayajam, Kshadajam and Shayajam, we know that we need proper Shodhana therapy, we need to do the Pajana properly, then go to Snehana. Especially the Pajana can be better not to adopt the Kadu Pajana Dravya, because here also the vitiated doshas will be mostly the Pitta and Rekta. So always if we use much Ushna Dravyas for the Snehana or this Pajanas, etc., so there is a chance of increase of Vidagdha. The Pitta may turned as Vidagdha. So always better to use as Pajana with the Tikta Dravya. Pajana can be done with the three types of Dravya, with the Tikta Dravya, with the Kadu Dravya, with the Amla Dravya. So we have to do all these Vajana Dravyas has to be differentiated or has to be given in different conditions. Not Panchagola cannot be given all the conditions for Pajana. Shadharana is not suitable for all the conditions because these two are the Kadurasa Pradhana Dravya, and this should be given only when the Sama Kapha Lakshanas are exhibited. Then here usually the Kshatraja and Kshayaja. Preferably of the vitiation of Pitta and Rekta. Here we have to go for Tiktarasa Pajana, Pajana with Tiktarasa. That is nothing but the Dravyas we can use is nothing but Pajanamradam Kashaya or Amrudotaram Kashaya. Sorry, Pajanamradam Kashaya, or even Amrudotaram can be substituted with the Pajanamradam, or even Guluchyadi Kashaya, etc. We have to adopt in this condition. And either Sudarsana Vati or Sudarsana Churna or Mahasudarsana Vati, etc. is an option here. So this should be the line of the treatment. Now we will come to the Swasa. The yogas we will explain later. So this Swasa, we can mainly we have to think in the practical aspect. We have to consider only two aspects. That is the Swasa produced due to allergic cause and Swasa produced due to non-allergic cause. So always this is what the better we have to think that whether which is allergic or non. First, our first preference should be, or first line of diagnosis should be the whether this Swasa is allergic or whether this is due to any other reasons. So allergic cause is nothing but Tamaga Swasa. Simple Tamaga Swasa we can include. The only one possibility to be the allergic asthma is nothing but Tamaga Swasa. There are the other non-allergic cause, especially because of due to some of the brain damage or some of the other organ damage. Even some of the kidney failure, etc., may lead to Swasroga. So such conditions can be, that is nothing but Shudra, Chinna, Mahan Swasa and Urdhva Swasa. All the other four can be classified under the non-allergic form of Swasa. How? That we will see now. Now we will see Tamaga Swasa. Tamaga Swasa, usually the patient with Tamaga Swasa exhibits two types of symptoms. There are two phases. One is early the bronchospastic phase, and the second one is what we say inflammatory phase. So in the broncho, how to diagnose these two? The treatment here also differs in both the condition. Bronchospastic as well as inflammatory, the condition, the line of treatment is different. So bronchospastic phase, there will be the difficulty in expiration, severe chest pain or chest discomfort, and there will be severe congestion. These are the indicators of spastic phase. And in case of inflammatory phase, usually this is the secondary phase. The spasm continues and there will be respiratory edema. That how to diagnose this respiratory edema and the airway obstruction. There will be severe wheezing as well as there will be the different, the broken type of wheezing pattern will be there. So if we meet a patient, if a patient comes with these symptoms, better we have to diagnose whether he is in a spastic phase and inflammatory phase. The line of treatment is different in both these conditions. That's right. So we know the Tamaga Swasa, we know very well. There are now from this type of this much medicines, you might have understand that there are different types of medicines explained, different medicines which sufficient or which reduces the different types of vitiated doshas in each and every condition. So, but when we come to Tamaga Swasa, Acharya doesn't explain any of the dosha vikalpas in Tamaga Swasa, isn't it? There is no Vadika Tamaga Swasa or Paitika Tamaga Swasa or Kabaja Tamaga Swasa explained by Acharya. Then how to select the Vada Samana Swasahara medicine or Pitta Samana Swasahara medicine or Kapha Samana Swasahara medicine? We have to tabulate the symptoms of Tamagashwasa into different kinds. Which are they? That we will see. Individual dosha vigalpa of Tamagashwasa. We know the symptoms exhibited by Tamagashwasa are, that is Pradilomam, Siragachan, Udirya, Pavanakapam, Parigrihya, Sirogrivam, Ura, Parsuecha Pedayan, Kasam, Gurguraham, Moham, Irujim, Penasam Trisham, Karodi Vravegamcha, Swasam Pranopadabinam, Pradami, Tasiyuktecha, Nishtudan Dekshanam Suhi, Kritsa Sayana Susudi, Vishana Swastamichadi. Mekam Bushida Pragwade, Slash Malay Chavivatade, Sayapis Tamagoshata, Satya. This is the indicator. So, how we have to differentiate all the symptoms into different three groups. Even no Tamagashwasa patient will exhibit all the symptoms. So, the symptoms exhibited by the patient, we have to classify, or we have to tabulate into different headaches. How to get? See the Pradiromam Siragachan Udirya Pavana Kapam Parigrihya Sirograhana Ura Parsha Grahana and severe Sharira Pida Arati. Gurguram, Anubashayatu, Meka Ambushida, Pragwada. These are the symptoms exhibited by Vada dosha. So, if a patient with wheezing, along with this type of symptoms, that we have to diagnose it as Vadika Tamagashwasa, then only our treatment becomes proper. With the patient, if the patient exhibits severe wheezing, along with the Trishna, severe intense episodes, or excessive perspiration, we have to diagnose it as Paitika Tamagashwasa. If the patient exhibits Aruji, severe running nose, wheezing along with the cough, again the Meghambushi, the Pragvade, //. We have to diagnose it as Kaphaja Tamagashwasa. Then only we can make that our treatment more precise and easy. So it is very difficult to diagnose, differentiate or to formulate, to develop a common protocol for Tamagashwasa. Many of the patients ask, or many of the students ask, sir, what is the treatment line of Tamagashwasa? So what I have to say is, sir, there is no definite line for Tamagashwasa. Tamagashwasa should be again disintegrated, or Tamagashwasa should be again differentiated, whether it is Vadiga, whether it is Paitiga, or whether it is Kaphaja. So now we will see the medicine. This is the allergic condition. Now, let us go to the non-allergic. This is what I explained. The second one comes. The first one is nothing but precise diagnosis. And the second one is identification of red flags. The following, you should be very careful regarding the coming 3 or 4 slides. That, as per my opinion, if a person comes to you with this type of breathing patterns, you are not supposed to test the patient, because at any time, the patient may go to collapse. So which are they? That we'll see. There is one beyond respiration. You might have seen. The pattern is like this. It will be periodic breathing. Chinnat swasiti vichinnam. Marmat cheda rujardida. Sasweda murcha sanaha. Vastidaharuja. Adhodrup vipludakshascha. Muhyan rektega rojana. Shushkasya pralabandhino. Nashtachayo vitena. So the second and third lines will better not to go to much detail. But the pattern should be very, you should understand, you should observe the pattern of the chest, the movement of the chest. Even though if you are not able to auscultate properly, or if you are not aware to do the proper auscultation, you should observe, you should ask them to remove the clothes, and you should observe the movement of the chest properly. There will be Chinnat Shosidi Vichinnam. He will just, the breathing pattern will be like this. He will do like this, and there will be a no wheezing zone for a short time. Again, you will start like this. Again, there will be a loss. Again, we will start. If you are happens to any patient exhibit to you, comes to you with this type of symptoms, where it may not be the Chinna Swasa, or it may not be beyond breathing. So, but you should be very careful regarding the diagnosis. And this could be due to any of the injury of the pons. Injury of any type of brain injury. It may be some of the tumors. It may be some of the what was the previous traumas. Whatever it may be even the fits, the seizures, etc. also can cause injury to the pons. If any wheezing pattern are exhibited like this, you should refer the patient at least, or to the proper, either the neurologist or at least to a general physician, or else you should take an EEG definitely to identify to exclude the possibility. Chinna Shosidi with Chinna, Marma Cheda Rujardida. Then comes the another pattern, that is Usma Ul's breathing. It is known as. We'll see the pattern. There will be deep inspiration like this. It will be both the expiration and inspiration will be deep, and there will be a no wheezing zone. Again, will be like this. Mahata dino nadena Shosidi Krathan. Udhuyamana Sabdamdo, Mattarshabhaivanism, severe Mattarshabhaivanism, like what we say, the mad ox. So he will be just doing, he cannot sit, or he cannot lie down, or he cannot walk, whatever may be. He will be in such a condition that Sarvasu Avasthasuna Sharmalapam, whatever may be the condition, he will not be able to, he will not get any type of release. If a breathing patterns in your practice, if you come to do like this, definitely, and the patient will definitely, the term is called as air hunger. He will just do the forceful inspiration as well as forceful expiration. Such conditions, you have to think of any of the type of, there are different types of conditions, maybe diabetic ketoacidosis, it can be uremia, or it can be sepsis. A chronic diabetes, etc. If a breathing difficulty or wheezing occurring to a chronic diabetes, you should always suspect the ketoacidosis. Again, these are all a fatal condition that you need a ventilator support in this condition. So always be careful. Here also, you should undress the patient and you should observe the movement of the chest properly. Now, you might have seen this Urdhva Shwasa. And there is another condition called as apneustic breathing. Again, Udirkham Urdham Shwasityurdham. Naja Pratyaharatyatha. The Urdhva Shwasa will be there, but the inspiration will not be like this. And there will be the pattern will be like this. Again, there will be a forced inspiration. There will be a blank area. Again, there will be the same pattern will be repeated. This also, you can see the what we say, the breathing difficulty, especially in case of stroke, etc. You can just observe. Definitely, all of us, all the Ayurvedic physicians might have seen at least 1 or 2 stroke patients. So you just examine from your next day. You just examine your the patient's chest, especially in the stroke patient. Their respiratory pattern is a bit different. It will be like this. There will be a blank area, will be like this, and again there will be a blank area. So always, if you come to this type of conditions are increased too much, that also is alarming. In stroke, etc., there can be it's a normal line. Their breathing pattern itself like this. But if the condition is more severe, then you have to refer to a patient where you have to get a ventilator support. So the first two, especially the allergic condition, the allergic asthma, we can treat properly, and the other conditions we may be able to treat, but still you should be aware of such type of presentation. Now let us focus on the yogas. We will see the Kashaya yogas now, isn't it? Some of the Kashaya yogas, the common Kashaya yogas we will explain. Here I included Vyaghryati Kashaya, Dasmula Kadatrayam Kashaya, Nayopayam Kashaya, Balajiragati Kashaya, Ela Ganati into Ganta. I am explaining this in comparison. So Vyaghryati Kashaya. This Kashaya is explained in Jwara Chikitsa of Ashtanga Veda. Vyaghri Shunti Amradakvata, Pippali Churma Samyuta, Vada Sleshma Jwara Kasa, Swasa Penasa Shula. Vada Sleshma Jwara Kasa, Swasa Penasa Shula. So, indications are Vada Kapha Jwara, Swasa, Kasa, Penasa, Shula. This Shula, it can be either Parsha Shula, or it can be Amaja Shula, or it can be Kaphaja Shula. The site of action of this yoga is nothing but Amasya as well as Suras. The properties are Ushna. This yoga is Ushna, Tishna, Sroto Shodhana, Deepana, and Vatakapashamana. This yoga has got more action on either Pranavaha Srotas as well as Annavaha Srotas. So have you seen this one thing? One interesting factor. Vyaghri, Shunti, Amrita. 3 ingredients. Vyaghri, Shunti, and Amrita. And Pippali as a Churna, as a Prakshepa Dravya. Why Acharya included this Pippali as a Prakshepa Dravya? Why he didn't do this as an ingredient itself? That is the main thing. That is that points or that factor points to the nature of the yoga. Why can't he include this also? Instead of 3 drugs, why can't he include Vyagri, Shundi, Amrita plus Pipali as a Kashaya in the Kashaya itself? There is a great logic that is this yoga, the indication of this yoga is nothing but Jwara. The next stanza explained as Ushma Pittadride Nasti, Jwaro Natyushmana Vina, Tasmat Pitta Viruddhani, Tejet Pittadhiyatya. As Jwara is a Pitta Pradhana Vyati, especially in case of Vaitika Jwaras, you have to avoid all the Ushna Tishna Prayogas. That could be the reason for this adding this Pipali Churna. Here, the Acharya needs the Pipali Churna, the properties of the Pipali, that Ushna, Tishna, etc. properties that is needed here to break the Avarana of the yoga, to Avarana of the Kapha. But that should not provoke Pitta also. For that purpose, as a Praksheva Dravya, that is in the small quantity, Acharya explained, Acharya asked to include this Pipali as a Praksheva Dravya. So, Vyagri, Shundi, Amrita, Kvata, Pipali, Churna, Samhita. So, these are the practical. Now, as I previously explained the common properties of the yoga. But now, we have to see what type of presentation we can give this Vyagradi. Where we have to give this Vyagradi Kashaya. Where we have to give this Dasimula Karutrayan Kashaya. Where we have to give this Indukantan Kashaya. Or when what symptoms are exhibited by the patient, you have to select this Vyagradi. That is the main thing that we have to know. We know, as I explained previously, this is Ushna, Tishna, and Vada Kapasamana, and this is Srodha Shodhana. So everything is correct only. But not only that, that is not something, that is theory part. We should understand the symptoms exhibited by this. When the patient exhibits these symptoms, you should select Vyagradi. When the patient exhibits these kind of symptoms, you should select Dasimula Karutrayan. So, such a differentiation we will go through that. In case of fever, what could be the fever should be if the patient exhibits mild fever, because Vata Kapha always Vata Kapha is a mild fever. Tapahani, it is explained. Tapahani Ruji Parvasidoru, Penasa Sosana Kasa Vipanta. It is explained. So a mild temperature, the patient exhibits very mild temperature, but there is we can say that's a rise of temperature, not a fever. If the nature of cough is much productive, if the nature of cough is sputum is thick, severe whitish, patient may even complain as heaviness to the chest, but very difficult to explain. In case of swasa, in case of breathing difficulty, if the patient exhibits the symptom as difficulty in expulsion of sputum, he say that there is some tightness of the chest, but I cannot speak it out. In case of shula, either it can be parsha shula, or it can be amaja shula, or kabaja shula. That is sadopahullasavami guruttam, staimityaganavhagapapaseka, like that. So in such conditions, you can the best option is Vyagradi Kashaya. If a patient exhibits mild fever, productive cough, thick whitish cough with difficulty to expel, or the expulsion of much thick white sputum, the best option is Vyagradi Kashaya. Now we will go to the Dasimula Karutrayan. Dasimula Karutraye Kashaye Savrishaireva Makshika Praveda Swasana Anila Kasa Parsha Prishta Trigamurdha Rujatsu Sampravishta. Almost Vyagradi and Dasimula Karutraya has got some similarities and some differences. What are they? That we will see. Here the yoga explained in Sahasra Yoga only. So here also the site of action is Amasya and Urus. The properties are Ushna, Deepana, Pachana, again Vata Kapasamana. Almost all similar to the Vyagradi only. But because of the presence of Dasamula, this Dasamula Karutraya has got an extra added property, that is Shobhara. How to Shobha in the Urus? Not all the Shobha. This cannot be given in the Shobha, what we say, the pedal edema, or any other, what we say, the abdominal edema, etc. This Shobha typically refers to the edema related to chest, edema related to lungs. That is, it can be either pneumothorax, or it can be pleurisy, or it can be pyothorax, or it can be hemothorax. Whatever it may be, whenever the patient suffers from, is diagnosed as a pneumothorax, etc., we need the Shobhara kind of medicine. That too, Shobhara with an action over the Urus. There are other Shobhara medicines also, isn't there? Are Punarnavadi Kashaya is there. Sukumara Kashaya is there. There is one Arthavillam Kashaya is there. There are Bhatyadi Kashaya is there. These are all Shobhara medicines. But all these medicines have got actions on different systems. Brihatyadi can be given in the Shobha produced due to the renal pathology. Arthavillam can be given in the symptom, the Shobha produced due to the abdominal pathology. Sukumaram can be given in Shobha produced due to the abdominal pathology. But in case of Dasamulagatraya, the Shobha, which is related to the chest, that is lungs, the Shwasaroga, we can use this Dasamulagatraya as an option. Here also, as Vyagriyadi, we will see this Dasamulagatraya, where we have to give this Dasamulagatraya precisely. If the type of intermittent fever, again, Vata Kapha, nature of cough, whether it is dry or scanty. If the patient exhibits nature of sputum as nil or scanty, or patient may complain as dry cough with the presence of very less sputum. But very difficult to explain. And another thing is exertional dyspnea. Then again, flank pain, especially the the pain produced due to the excessive strain during the cough, etc. The best option is Dasamulagatraya. Now we will compare both the medicines, Vyagriyadi and Dasamulagatraya. So, Dosha Samanatva, both Vyagriyadi and Dasamulagatraya are Vata Kaphasamana only. Vyagriyadi is Kapadiga Vata Kaphasamana and Dasamulagatraya is Vatadiga Vata Kaphasamana. That means the Kapha symptoms are more, Vata symptoms are less. You can just opt Vyagriyadi. And Vata symptoms are more, Kapha symptoms are less. You can select Dasamulagatraya. Vyagriyadi and Dasamulagatraya are equally Ushna. Tikshna properties are more with Vyagriyadi. Srodoshodhana is more with Vyagriyadi. Deepana Pajana, both are Deepana Pajana are more similar. Shobharatva, again, as I explained, Dasamulagatraya is more Shobhara and Vyagriyadi doesn't have Shobhara property. Kaphanisaraga properties, comparing to Vyagriyadi has got more Kaphanisaragatva, that is expectorant properties more with Vyagriyadi comparing to Dasamulagatraya. This is how we can compare both the Shobharas. Now we will see another condition, that is Nayobhaya. Only 3 ingredients, Balajiraga Nagara. Reference is Chikitsa Manjari. Swasa Hitma Harampara. These are the ingredients. Swasa Hitma. Again, see the ingredients Bala, Jiraga and Nagara. Properties are Vata Kaphasamana, Pajana. Srodas is Pranava Srodas and Annava Srodas. Now, here, where we have to select this Nayobhaya and Kashaya. Fever, there is no much action with the Nayobhaya. Nature of cough. If the patient exhibits severe dry cough or very scanty of sputum. Again, nil or scanty of sputum. Again, dry cough with very like this Dasamulagatraya. Again, this is very effective in case of exertional dyspnea as well as hiccup, severe type of hiccup. Then the main important area is GIT related. Bala, Jiraga and Nagara. Due to the presence of Jiraga and Nagara, the Nayobhaya and Kashaya has got a very extensive property, or it's very much effective in case of GIT disorders comparing to the Vyagriyadi or Dasamulagatraya. So in conditions like aseptic disorder, abdominal distension, spasmodic abdominal pain, etc., this Nayobhaya is very effective. And if the patient complains with dry cough along with abdominal distension, you can select this Nayobhaya. Patient complaint, dry cough along with exertional dyspnea, you can select this Vyagriyadi, Nayobhaya and Kashaya. Again, the patient complains with loss of appetite and severe type of vomiting sensation. The best option, the wheezing with vomiting sensation or wheezing with the hiccup, the best option is nothing but Nayobhaya. Now, see the other medicine called Balajiragadi. Here also, Balajiragadi also, we can say this Balajiragadi as fortified Nayobhaya. All the 3 ingredients are there. In the 3 ingredients present in the Nayobhaya is there with Balajiragadi also. Balajiraga Nagara. Again, here, Balajiraga Villo, Musta Vusha Vishsurudrumi, Buhekshu Laja Sahidea. The yoga is mentioned in Sastra Yoga, Swasa Kasa Harampara. Here, which is the site of action is Udanavata and Vyanavata. The medicine is Ushna, Lakhu, Vata Samana, Deepana and Grahi. Always think here this grahi is not the grahi. Always we have a misconception of this grahi. When we say this grahi, most of us think that causes constipation. But it is not. The term grahi is not it's not the dravya which causes constipation. See, the deepanam, if a yoga is deepanam pajanam yattat ushnatva dravashoshakam grahi tatchetha shundi deepanam gajavipali jeerakam gajavipali. So, if a dravya which has got a properties like deepana as well as pachana, and by its ushna nature, if it reduces the excessive jaliya bhava from the body, maybe extracellular fluid or whatever it may be, it can be termed as grahi. So always never think that grahi is not the medicine, not the group of medicine that cause constipation. Grahi can be given in many other conditions where you are suffering with the Kleda predominant conditions. It can be given in postnasal drip, severe running nose, etc. The grahi medicines are very effective. So such thing, whenever there is Kleda Pradhana, you can select this grahi as an option. Now here also, in the case of fever there is no much relation with fever, this yogas also. Again, like Nayopayam, dry or very sputum. The nature of sputum is also similar with Nayopayam. Exertional dyspnea, chronic asthma. And here also GIT, again as Nayopayam, this also is very effective in conditions like acid peptide disorder, abdominal distension, spasmodic abdominal pain. Now we will see difference. Nayopayam is, both are Vada Samana. But at the same, Nayopayam is Vada Samana, with no, it is not Kapha Vada. This Balajiragadi also Vada Kapha Samana. Vadadhika Vada Kapha Samana. Nayopayam is simple Vada Samana. This is the difference between. Both are Ushna. Grahi property is more with Balajiragadi. Deepana Pajana properties are more with Balajiragadi comparing to Nayopayam. This Kapha Nisaragatva action is absolutely not there with Nayopayam. So that you should be very careful regarding. If a patient exhibit with severe productive cough, with what we say the purulent cough, etc. If we select this Nayopayam or Balajiragadi, the result may not be satisfactory. So always you should think of this type of possibilities. Now the other medicine, that is Ela Kanati. Ela Kana Matuga Nagara Abdavasa Nimbamradambu Dashamula Sudakashayam. Again here comes this Dashamula. The Anubana as Laksha Sita Matuga Jiraka Sampayukta. There are 4 types of Anubanas, that is Laksha, Sita, Matuga and Jiraka. This Vaidiratnam Aushadha Shala produces this Lakshadi, this medicine, this Anubana as Lakshadi Churna. That is Laksha, Sita, Matuga and Jiraka. Now when we come to the properties, it can be effective in occasional with a mild fever. Acute exacerbation of chronic diseases like COPD. If the patient is a COPD patient, there can be acute exacerbation. Because of any of the type of Nidana Sevana, there can be an acute exacerbation. In such conditions, comparing to the other medicines, this Elaganati is found to be more effective. If the nature of sputum is acute, the thick, purulent, and if the patient says that I am getting the relief once I spit the sputum. So this medicine here, you can select this Elaganati. Again, exertional dyspnea, fatigue as well as lethargy. Anorexia, this aruchi or abdominal distension or vomiting, GIT symptoms. Here also you can select this Elaganati. So always the thing is the Elaganati is more stronger comparing to Nayopayam and Balajiragadi, but less stronger, less Tikshna by comparing to Vyagradi and Dashmula. These are the common kashayas. Now we will see some of the avalehas as well as churnas. I think we can finish within 15 minutes. So there are so many avalehas in the markets. There is Agastya Rasayanam, there is Pushmanda Rasayanam, Mridugadi Lehyam is there, Talisamutradi Lehyam is there, Drakshadi Lehyam is there, then Vasishta Rasayanam is there. These are some of the lehyas which has got indication with the Kasa and Swasa. Where do we have to give this Agastya Rasayanam? Where we have to prescribe Mridugadi Lehyam? Where we have to prescribe Drakshadi Lehyam? Where we have to prescribe Pushmanda Rasayanam? That we will see now. For that purpose, we will compare this Agastya Rasayanam and 2 similar yogas with almost similar ingredients. We will compare with Agastya Rasayana as well as Vasishta Rasayana. So the key ingredients of this Agastya Rasayanas are nothing but Dashamoola, Soyangupta, Dashamoola Soyang Hasti Vipalya Apamarga, Pippali Moola Chitraka. And Yava Adhaka. Yava becomes the key ingredient in the Agastya Rasayana. The other ingredients like Grita, Taila, and Guda are also presented here. The action of Dhadu is Rasa. Then the site of action is Amasya and Parshashula. Then the karma, the indications are, there are some interesting indications. That is that Vali Palidanasana, Panchakasa and Chayan, Swasam, Itma, Gulmam, this Vali Palidam, etc. There are some of the other unexpected indications here. So here now we will see what are the, why Acharya included this. See, there are some unexpected ingredients also, isn't it? Dashamoola Soyangupta, Asti Vipalya Apamarga, Haridagi Sadam Cheva, Yavanam Adhagam Chada. Haridagi and Yava. Why Yava included in this type of condition? In this, Yava came here as a main chief ingredient. What could be the reason? Why Acharya included Yava? And why Acharya included Dhrita, Taila, and Guda? So that is the common, when we understand that, this reason, we will find out the exact point, we will find out the exact nature of the yoga. So Yava is nothing but, we know the Ruksha Shidosha Guru Swada, Ruksha Shido Guru Swada, Saro with Vadakrit Yava. With Vadakrit Yava. Yava is Vata Varthana. And why Acharya explained a Vata Varthana Drivya in Agastya Rasayana, a yoga with a Vata, which has got a Viguna Gati of Vata. Nothing, you can see the Avarana. Here comes the importance of Avarana. Yavanam Vigriksharam, which I explained previously. That's why what we say, the Yava is nothing. Ruksha Shido Guru Swada Sarovit Vadagrit Yava. Here also, when we comes to the properties of this Yava, again the another indication is where we have to do this Yava. This then why we should be given this Abhaya. Swinna Sangrahini. Abhaya, we are adding this Abhaya as after this boiling with that. When we go to Bhava Prakasha, Acharya explained that Charvida Vardhaya Techni, Peshida Marashodhani, Swinna Sangrahini. The Swinna Haridagi. In this condition, we are adding this Swinna Haridagi. Swinna Haridagi is Sangrahi. To prevent the Sangrahi nature of that, or the Grahitva, Acharya added this Grita. It's to balance the Grahi nature of Abhaya. Swinna Haridagi, Acharya added this Grita as an antidote. Then, Kabhavrde Yavanani Jangaran Mugavakshino. Kabhavrda Vata. The best medicine is nothing but Yava. But at the same time, Yava is Vata Vardhana also. To compensate the Vata Vardhana Swabhava, Vata Vardhana character of Yava, Acharya added Taila and Grita here. So this could be the logic behind this, the inclusion of Abhaya, Yava, the unexpected ingredients like Abhaya, Yava, Guda, and Taila Grita. So here also, where we have to give Agastya Rasayana. Better not to give this Agastya Rasayana as an initial step of medicine because it needs proper Agni. This can be given as a Rasayana. Once the first line of treatment has been finished, that is, first Samana line has been finished, or first Anulomana line has been finished, then we have to give this Rasayana. We can give this Agastya Rasayana as a Rasayana therapy. Not Agastya Rasayana has got Rasayana. It's a Rasayana. It is not a Samana treatment. Definitely, it is not a good option in case of acute exacerbations. And again, the best option in the conditions along with the respiratory conditions, along with the GAT symptoms, that is with the constipation, with what we say, the excessive abdominal distension, excessive burning sensation, etc. If the patient exhibit, the wheezing patient exhibit these kind of symptoms, the best option will be Agastya Rasayana. Now we will see the Mrudyugadi as well as Drakshadi Lega, which has got almost similar combination. Mrudyugadi, Mrudyuga, Pippali, and Sharkara. These are the main ingredients. In the case of Drakshadi, Draksha, Pippali, Sharkara, with Madhuka, Shundi, Tugakshiri, and Dhatri Surasa. So again, as I told previously, fortified Nayopayam is Balaji Regadi. We can say as fortified Mrudyugadi is Draksha. The method of preparation is different. Mrudyugadi, what we have, it's not doing as a Lehya Paka. We are just pounding all the ingredients together and making into a Lehya Paka. At the same time, Drakshadi, we are doing as the preparation method is as a Tavaleya Paka. Sahapana is Madhu. Indication, typically Mrudyugadi is indicated in Paitiya Kasa. The textual indication is of Drakshadi is nothing but Halimagam, Pandu and Kamala. But there is no indication in Kasa and Shwasa. So, but by considering the ingredients, we can see that the Drakshadi is equally effective in this type of respiratory pathologies also along with the other one. So now we will see the action of that. Mrudyugadi and Drakshadi are Pitta Kapsamana. Mrudyugadi is Kaphadika Pitta Kapsamana. At the same time, Drakshadi is Pittadika Pitta Kapsamana. Both the medicines are equally effective in Prana, Rasa and Raktavasodhas. Mrudyugadi, Drakshadi is more effective in Pranavasodhas, Rasavasodhas and Raktavasodhas. Because that's why the Acharya included this Grahani, Pandu, etc. as an indication. Mrudyugadi has got Chedana, Lekana and Kaphanisarga property. At the same time, Drakshadi is more Samana. Kaphanisarga, Balya and Rasayana. The Rasayana Swabhava is not there with the Mrudyugadi. Mrudyugadi is more of Samana as well as Drakshadi is more of Rasayana. These are the difference between both. So, now we will go to the first part. Mrudyugadi can be given in Paitiga Kasa with Ghanakapha and Drakshadi can be given in Paitiga Kasa with the Tanukapha. Typically, as a spoon feeding, we can say that Paitiga Kasa with the Ghanakapha, Mrudyugadi. Blindly you can prescribe. Paitiga Kasa with the Tanukapha, Drakshadi. Just feed this. Now, Talisapatradi Vatakam, only one or two are there remaining. Talisapatradi Vatakam and Talisapatradi Leham. Both are just one different. Both these medicines. That is, ingredients are Talisapatra Chaviga, Marija, Tipali, Shunti. At the same time, in case of Talisapatradi Lehya, in place of Shunti, Shunti is replaced with Abhaya. Abhaya Nagarasthani, Dadyada, Traja Vitrehi. So, but one is Vataka and the another is Leha. That is the main difference. The Anupana is explained as Madhya Yusha Rasa, Arishta, Mastu, Peya, and Paya. And Talisapatradi, in which kind of patients or which kind of symptoms we can give Talisapatradi Vataka, in which kind we can give Talisapatradi Leha. Typically, Vata Kapacha Kasa Swasa with normal wit Pravartana. If the bowel movements are normal, you can opt this Talisapatradi Vataka. At the same time, if the same kind of symptoms along with Graha as a symptom, if the patient exhibits constipation as a symptom, the best option will be Talisapatradi Lehya. So always think Talisapatradi Vataka is not a universal medicine in Kasa and Shwasa. It has got specific indications. It is Vata Kapha. Only the patient with Vata Kapha predominant Kasa Shwasa you give that too with a normal wit Pravartana. Because it has got a tendency to reduce the excessive grahya jalamsha from the koshta and that produces vidbrantha. At the same time, because of the replacement of Shunti with Abhaya, the Talisapatradi Lehya becomes with Pravartana. This is the difference. So, both are Vata Kapha only. Talisapatradi Vataka is Kaphadika Vata Kapha and Talisapatradi Lehya is Vadadika Vata Kapha. The Srodho Shodhana properties are almost similar. Both the medicines are Pachana, Deepana, Kleda Shoshana and Ruchya. At the same time, Talisapatradi Vataka is Grahi and Talisapatradi Lehya is Analogana. These are the differences. Now, the one Kushmanda Rasa. Nishkuli Virti, we know that Nishkuli Virti Kushmanda, Nikshipati Gunam Shive. Like that it continues. The main ingredients are Kushmanda, Siddhaganda, etc. The medium is ghee only. It is Vata Kapha because the indication is nothing but Shataja Kasa. So action on Dhadu, which is Rasayana, Rasa, Rekta and Mamsa and Medas. Site of action is Uras and Shaka, which is Brahmana as well as Rasayana. Indications are Kasa, Hitma, Jwara, Swasa, Rekta, Vitta and Urasandhana. Urasandhanagara is nothing but Shataja and Trayaja Kasa. Urakshada. Urasandhanagara means nothing but Urakshada, that is Shataja Kasa. So Ushman Rasayana is the best option as a Rasayana in chronic condition. Again, as I told you, Rasayana, once the debilitating disorders, after the proper Samana therapies, you can select this Ushman Rasayana as a Prasha or even as a Rasayana for a long time. Definitely, it is Kapha Vardhana in nature, and thereby you are not supposed to give it in the acute exacerbations. And the yoga is not Pachana or Kapha Nisarga. It is purely of Brahmana as well as Rasa. Now, by comparing this, by analyzing this Haridra Khanda, we'll stop this. So, the ingredients are Haridra, Triphala, Ghrita, and Kshira. It is also Pitta Kapha Samana, and the yogas are it has got Pitta Kapha Samana yoga. The site of action is nothing but Koshta. Karma means Visha. It has got what we say, an extra indication, that is Vishahara, because the indications is Odha, Sita, Pitta, and Udarta. But we all give this Haridra Ganda in type of allergic reactions, isn't it? Especially in respiratory allergy than the other type of disease, like this Sita, Pitta, and Kodha. What is this Kodha and Sita, Pitta? Asamyak Vamano, the Kodha and Sita, Pitta are nothing, are almost Udarta and are almost similar. Chidapaniya Samsvarsat, Chidagali Visheshada, Saraga Kandu Shokam Syadu Sakapotva, isn't it? So the Haridraya Balanyashtu, Shatpalam, Havishastadha, this is explained. Sida Pittu Udarda Kodhans, Saptaha Devanasi, the indication. So, how a medicine, Kodha is Kapha predominant, but we say Vada predominant. Sida Pitta is Pitta predominant. Udarda is Kapha predominant. How a single drug becomes effective in all the Vada, Pitta, and Kapha? Does it Tridosha Samana? I don't think so. But it's not Tridosha Samana, but it has got an action over all the doshas. How? It has got an effect over this Kodha, Sita, Pitta, and Udarta, because it is Vishahara in nature. So you can see these ingredients. You can just check the ingredients of this Haridra Khanda. Haridra Khanda is, again, as I told, fortified Nayopaya is Balaji Ragati. Or fortified, what we say, the another one I told you, sorry, I forgot. So we can say that the base of this Haridra Khanda is nothing but Avibhatti Chodhan. Almost similar yogas with the same kind of Avibhatti, the Avibhatti yogas, along with the Avibhatti yoga we know, Vyosha, Trijadaga, Ampoda, Krimigna, Amalagay Trivar, Sarvai Sama, Samasita, Chaudrena Gurgi Gada. Avibhatti Riyam Nama, Prasasta Vittarogina. So, this yogas, if we are adding Vibhidagi, Haridagi, Haridra, and Lohavasma, that yoga becomes Haridra Ganda. This is the difference. So, Avibhatti is the one which has the medicine which has got Vishahara properties. So, this here also, this Haridra Ganda becomes effective in all this kind of medicine, disease, that is Pitta predominant, Sita Pitta, Kapha predominant Udarta, and Vada predominant Kodha. It is not due to which is Dosha Samanatva, but it is due to the Prabhava, like Vishaharatva. So this is what I have to say about that. I think I have compiled almost all the common popular yogas available in the market. So probably now in the next part is Rasa drugs, that I think you have got a detailed class of this Rasa with another one, so I'm not going to details in that. So let me conclude my presentation here, that by saying that we need to evaluate each and every symptoms critically. Blindly, you are not supposed to give Dasamulakarutraya or Vyakhati. These are not the universal drug. Talisapatradi Churna or Talisapatradi Vadaga are not the universal drug in Kasa. Agastya Rasayana is not the universal drug in Kasa or Shwasa. These are the main things but we have. There are so many other yogas in our armamentarium. So always think over the indication and try to generate or try to understand the common properties of the yoga, and then you select the medicine. So if you do this, we can reduce the number of medicine, and thereby we can reduce the total cost of the treatment itself. Once again, I thank the organizer for giving me a chance. And if any doubts are there, I will be happy to clear that. If it is beyond my knowledge, I will just refer it and will get back to you soon. Once again, thank you very much.
First of all, let me thank you, sir, for this wonderful session, because as you had said, you have